In this lecture, we are going to discuss mechanism of penicillin resistance, how bacteria develop resistance against the penicillin and the different adverse effects of the penicillin. So most important component that is actually present in the cell wall of the bacteria is the peptidoglycan. So actually penicillin will inhibit the formations of the peptidoglycan. Okay, so if you see the structures of the peptidoglycan, so peptidoglycan. So peptidoglycan has two most important components. Glycan chain. Here you see the glycan chain, two glycan chain, and in between the glycan chain you will see the presence of the peptide. Okay, so in the glycan chain you will see the two most important component, NAG and the NAM. NAG, NAM, alternate NAG, NAM, and acetylglucosamine and acetylmuramic acid. Okay, in between the glycan chain you will see the peptide. Okay, so here is basically the tetrapeptide. Tetrapeptide. You will see the presence of the 4 amino acid. Similarly, at that side, you will also see the tetrapeptide at the NAM side and acetylmuramic acid. Okay. And in between the tetrapeptide, you will see the interbridge peptide. Okay. So here is the interbridge peptide. Interbridge peptide. So now you will see the cross-linking or formations of the bond between the interbridge peptide with the tetrapeptide. Now, the formations of the bond between them will be happens in the presence of the enzyme, and that enzyme is actually called the transpeptidase. Transpeptidase. Okay. Transpeptidase will bind the interbridge peptide with the tetrapeptide at the both sides. Okay, that's the normal process, and that is the last step of the formations of the peptidoglycan. But penicillin will inhibit this process, will stop the transpeptidations between the tetrapeptide and the interbridge peptide. So we will see how. So when the penicillin enter into the bacteria, now here is the penicillin. This penicillin will bind to that enzyme, that is the transpeptidase. When this penicillin bind to the transpeptidase, it will inhibit the activity of the transpeptidase. When you will see the inhibition of the activity of the transpeptidase, then there is no formations of the bond between the interbridge peptide and the tetrapeptide. So ultimately you will see the peptidoglycan strength will reduce, and ultimately the peptidoglycan will break, and as a result water start entering into the bacteria and the rupture of the bacteria. Okay, so penicillin actually destroys the bacteria, and this is how penicillin will destroy the bacteria, by stopping the transpeptidase enzyme, and ultimately destructions of the peptidoglycan, and ultimately destructions of the whole bacteria. Okay, so actually transpeptidase bind to the penicillin, so on the basis of this we call transpeptidase as penicillin binding proteins. Okay, we call the transpeptidase as penicillin binding proteins. So actually it binds to the penicillin. On the behalf of this we called it penicillin binding. And why do we call it proteins? Because as we know that the enzymes are actually proteins. So transpeptidase, or you can say penicillin binding proteins. Okay, but bacteria will develop resistance against the penicillin. How? Bacteria with the passage of the time start developing an enzyme that will destroy the penicillin, and that enzyme is the beta-lactamase, or you can say penicillinase. Okay, so here is the enzyme, that is the beta-lactamase, or you can say another name of this enzyme is the penicillinase. Now this enzyme will destroy the penicillin. Okay, if the penicillin enter, then that enzyme will take the penicillin, here is the penicillin, and destroy the penicillin. So as a result, when you will see the destruction of the penicillin, and after the destruction of the penicillin, transpeptidase can easily do its work. So that's the most important thing. So that's why with the production of the beta-lactamase, enzyme or bacteria can develop the resistance against the penicillin. Okay. And last most important thing, in the penicillinase treated bacteria, you will see the activations of the enzyme, that is the autolytic enzyme. Autolytic enzyme that are actually present inside the bacteria. Here is the inner side of the bacteria. Autolytic enzyme, or you can say murine hydrolases. Now, in the penicillinase treated cell, you will see the activation of the autolytic enzyme, or you can say murine hydrolase. These autolytic enzyme will start destroying the peptidoglycan itself. So that is another important thing. Penicillin will do two things. Penicillin inhibit the transpeptidase, or you can say penicillin binding proteins, and penicillin will also activate the autolytic enzyme or murine hydrolases that will also destroy the peptidoglycan. But some bacteria are tolerant to the penicillin. So in those bacteria, you will never see the activation of the autolytic enzyme. When there is no activation of the autolytic enzyme, there is no destruction of the peptidoglycan. So up till now, we have discussed three most important enzymes, that is the transpeptidase that actually do the transpeptidation. Okay, next is the autolytic enzyme that actually destroy the peptidoglycan of itself, and that is the beta-lactamase, or you can say penicillinase, that is actually the resistance enzyme of the bacteria. So if we discuss the resistance, how bacteria develop resistance against the penicillin, so most important component is the permeability. So entrance of the penicillin into the bacteria is very much important. If there is no entrance of the penicillin into the bacteria, then there is no action of the penicillin. That's the most important thing. If you look at the membranes of the bacteria, so here is the gram positive and here is the gram negative. In the gram positive, you will see here is the cell membrane of the positive, here is the cell membrane of the negative gram bacteria, and here is the, at the green side, you will see the peptidoglycan. At the green, you will see the peptidoglycan. And in the negative case, you will see also the presence of the outer membrane that is actually made up of lipoproteins. And in the outer membrane, you will also see the presence of the channel, that is the porine channel, through which the hydrophilic substances can pass through this channel. Okay. So if I say here is the penicillin, here is the penicillin. Now penicillin can easily interact with the peptidoglycan in gram positive, because the peptidoglycan is directly faced to the environment. So penicillin can easily attack on the peptidoglycan in gram positive. But in the negative case, you will see the penicillin will face the outer membrane and will also face the channel. So it means that in the gram negative bacteria, penicillin will face the barrier to reaching the peptidoglycan. Okay, so that's why gram positive bacteria is more susceptible by the penicillin as compared to gram negative. Okay, so there is a bacteria which has reduced porine permeability. Actually, penicillin is a hydrophilic compound. So penicillin can easily pass through the porins. But there is a bacteria which has reduced penicillin permeability porine, and that is the Pseudomonas aeruginosa. That bacteria has reduced porine permeability. So that's why the Pseudomonas aeruginosa develop resistance against the penicillin, because in this bacteria there is reduced permeability of the penicillin through the porine. When there is no reaching to the peptidoglycan, then there is no actions of the penicillin in that case. And there is an other bacteria which has efflux pump. If I say this is the bacteria and here is the pump, in that case here is the pump. Now that bacteria is actually the Klebsiella pneumoniae. Now Klebsiella pneumoniae has efflux pump that will move the penicillin outside the environment. So as a result, you will see that bacteria will also develop the resistance by removing the penicillin from itself. So here are basically the resistance mechanism of the bacteria. Second is the beta-lactamase, as we have discussed. Here is the beta-lactamase, or you can say penicillinase. This enzyme actually destroys the penicillin. When you will see the destruction of the penicillin, then you will see the resistance against the penicillin. Okay, that's the beta-lactamase. So actually beta-lactamase is an enzyme. So enzyme is actually coded by the DNA. So you will see this enzyme is actually produced by the bacterial chromosome, or you can say plasmid. Plasmid, or you can say chromosome, will form the messenger RNA, or that ultimately forms the proteins. That is the beta-lactamase. So beta-lactamase is an enzyme that is actually protein in nature. So actually bacterial chromosome and the plasmid encode the formations of the beta-lactamase. Okay, and as a result you will see the development of the resistance against the penicillin. And last is the penicillin binding proteins. Okay, that is the penicillin binding proteins, or you can say transpeptidase. Now bacteria will change transpeptidase by changing its genetic material. So as we have already discussed that the DNA form the messenger RNA. From the messenger RNA you will see the formations of the proteins, and transpeptidase is actually a proteins. Now if the bacteria make some changes in the DNA, then you will see the changes in the transpeptidase. When you see the changes in the transpeptidase penicillin binding proteins, then penicillin will not bind to the transpeptidase. When there is no binding of the penicillin to the transpeptidase, then there is no inhibition of that enzyme. So here are basically the three most important mechanisms by reducing the permeability to the penicillin, by the development of the beta-lactamase that actually destroy the penicillin, and last is make changes in the transpeptidase. So that's why penicillin do not bind to the transpeptidase. So here are basically the three most important resistance mechanism of the bacteria. And last you will see the different adverse effect. So most important adverse effect is the hypersensitivity reactions. So you can remember it by the adverse effect H, N, and D. So first is the hypersensitivity reaction, in which you will see the rash, you can see the urticaria rash, and angioedema. In that case, you will see the swelling of the lips, tongues, and the swelling around the eye, periorbital swelling in that case. And you can also see the anaphylaxis reaction in that case, and that actually mostly happens in 10% patients. Okay, next is the hematological adverse effect, in which if someone take the piperacillin and the naphthalene, if I say piperacillin and the naphthalene, so in those patients you will see the reduced coagulation effect, coagulation process, when someone take the piperacillin and the naphthalene. And you can also see the cytopenia, reduce blood count when the regimen time is greater than the 2 weeks. When someone takes the penicillin greater than 2 weeks, then that patient will also face the cytopenia, reduced blood count. Okay, that is the hematological effects. Next is the nephritis, most important. Here is the adverse effect, that is nephritis. acute interstitial nephritis, specifically that is related to the methicillin penicillin. So that's why on the behalf of the severe adverse effect of the methicillin, so methicillin is not actually used clinically. So that is the most important thing. Next is the neurological effect, okay, in which you will see the effect on the neuronal tissue. That's the most important thing. If you give the if you administrate the penicillin directly into the CSF through the intrathecal effect, then that patient can face the seizures as well. And that is more, please do not prescribe penicillin in the epileptic patients, because the penicillin can inhibit the GABA. So ultimately the epileptic patient will face the severe adverse effect of the penicillin in that case. So here is the neurological defects. And next you will see the diarrhea. So when the reduce in the absorption of the penicillin into the body, so penicillin will stay in the intestine. When the penicillin will stay in the intestine, then that penicillin will destroy the intestinal normal flora. When you see the disturbance of the normal flora, then you will face the diarrhea as well. Diarrhea in that case, due to the disturbance of the normal flora by the penicillin. So this is all about the mechanism of the penicillin reaction or resistance that actually bacteria develops against the penicillin and the different adverse effect of the penicillin. If you still have any question, you may ask in the comment section. Thank you so much.